Hello and welcome to the Straits Times webinar, Keeping Singapore Healthy. I'm Salma Khalid, health correspondent at the Straits Times. Singaporeans enjoy one of the longest life expectancies in the world. But to truly enjoy a long life, people need to remain in good health. The recent announcement by MediShield Life that premiums for people 60 years and older need to be raised by more than a third comes as a wake-up call. The Health Ministry says this is needed to cope with a 50% increase in both the number of claims and total payouts for older people in the past 5 years. Has our health deteriorated so badly in just 5 years? Can anything be done to reverse this in older people and to prevent it in those who are younger and still healthy? With me today are three experts who will address this. Two seats to my right is Professor Tan Chua Chuan, who comes with a wealth of experience as both the Health Ministry's Chief Scientist and the Executive Director of its Healthcare Transformation Office. He was also the Director of Medical Services during the SARS outbreak and was President of the National University of Singapore for a decade. Mr. Dennis Tan, sitting right next to me, is the Chief Executive Officer of Prudential, which has the largest number of new policyholders of integrated MediShield Life plans, or IPs, so Prudential is obviously doing something right. And at my far right, Mr. Zee Yong Kang is the Chief Executive Officer of the Health Promotion Board, the government agency tasked with improving the health of people here. One of his main jobs is to get people to eat better and to exercise more. A very big welcome, gentlemen. Dennis, Prudential provides medical insurance for a lot of people here. Could you tell us what are some of the major health areas seeing higher claims in the past few years? And are there any particular areas of concern to insurers like you?
Salman, the truth is that in the whole industry, we are seeing claims actually rising. And this is because of increased consumption of healthcare services by the public, and coupled with the rising costs in terms of medical inflation. So as we kind of look into our Prudential's data over the last couple of years, right? Yeah. Specifically for claims data, it's showing us that we are looking at a double-digit growth in terms of claims submission. And that's the reason why, beyond just paying for claims, we as an insurer, we want to kind of move into preventative healthcare to partner our customers in terms of healthy living. So to answer your question in terms of specific claims, in terms of critical illness, we have observed that there are the top three reasons for claims would be treatments related to heart, to stroke, as well as to kidney treatments.
Kidney,
not
that's cancer. Right. Kidney treatments.
Kidney, yeah. So okay. These are the top three in terms of specific critical illness. And when we deep dive into the data, we are seeing that actually the most submissions is coming from a particular age band as well. So for policy holders who are in the age range of 46 to 55.
Wait, sorry, 46 to
55 years
55.
old.
That's quite young, isn't it?
That's pretty young. That's pretty young. And actually one final thing is that when we look at the data, it kind of pains my heart as well, but we also see claims coming from time to time. There are people who are less than 35 years old, but who are submitting claims for cancer. So cancer is something that is hitting not just the elderly, but across as well, across age range.
I find that quite shocking that so many younger people, I would have thought they would be in their 70s or 80s when they have heart problems and stroke, but you're saying from mid-40s to mid-50s.
That's right.
Oh dear. Ballooning claims actually reflect a sicker population, and that's really worrying. But the real question here is whether any of these medical conditions that you have mentioned could have been prevented, or is it just part of growing older? Although now, from what you tell me, it's not so much older; it's middle age, and you start getting these problems. Chua Chuan, as the only doctor on the panel, could you give me your take on this? What's happening with the Singapore people?
Well, actually, the good news is that a lot of these diseases are preventable. If you look in the Singapore context, if the burden of disease that we have as reflected by a measure called the Disability Adjusted Life Years, about 35% of our dailies are due to things that are potentially modifiable.
Sorry, you are saying about 1/3 can be prevented,
more than
modified?
a third are preventable. And they are the things that we are very familiar with. Eating healthily, not smoking, as well as exercising. And if you have high blood pressure, diabetes, or high blood cholesterol. If you control that well, then you can prevent a lot of this. It also affects mortality. There was a study by Public Health England in 2017 that showed that just 3 behavioral risk factors, diet, exercise, as well as cigarette smoking, just 3 of these accounted for more than 40% of deaths. And I think to Dennis's point, I think the main message, which is important to remember, is that prevention should be started as early as possible, but at the same time, it's never too late to start prevention. In other words, you should start it in the young, but prevention also works when it's started in older people. And we have to consistently do this in order to prevent the types of serious illnesses and deaths that we've heard about.
So you're saying that someone who has been smoking, say, for 10 years maybe, and then decides to stop. So there's already damage done to the body, but he decides to stop. What happens in his case?
Yes, you'll find that there's a reduction in the risk of heart disease, of cancers, and so on. So if you think about it, our main goal, that's Z's job, is to help work with individuals to prevent getting illnesses in the first place.
Right.
But even if you have an illness like hypertension or diabetes, if you control that well,
Right.
then you greatly reduce the risk of getting kidney failure or heart disease. And even after, if you're unlucky enough to have one of these, say if you had a stroke and you had high blood pressure,
Right.
if you control your blood pressure well, you can reduce the risk of a second stroke by 20 to 30%. So prevention can work at many levels and still be effective.
Could I just stick with you for a moment? Because Dennis brought up an interesting point. He says one of the problems is kidney disease. Would that be largely from diabetes? And I believe you're the expert, you're a renal physician by training.
Yes, so the commonest cause of kidney failure requiring dialysis in Singapore is diabetes. And it is preventable both at the point of not getting diabetes in the first place, but if you have early diabetic kidney disease,
Right.
if you manage that well, your blood sugar, your blood pressure, regular medical care, you can actually slow down the progression of kidney failure and reduce markedly your risk of getting onto requiring dialysis.
So getting diabetes, being diagnosed with diabetes is not a death sentence per se. You know, you can still prevent yourself from a lot of the complications.
Yes, that is true.
Yeah.
That is true.
Oh, well. So from what you say, there are a number of very serious diseases that could be prevented. But, you know, the problem really is that people know this information, you say, you know, eat well, exercise, etc. But nobody believes that they themselves will end up as part of this illness statistic. So they don't do anything to actively keep themselves healthy. So how do you convince people that they need to act and to act now? So Z, you're the Health Promotion Board, has been plugging at this for quite a while. Can you give a quick summary on whether you've been successful in getting people here to live healthier?
Yeah, so thanks, Selma. And I would like to join Cho Chuan in providing the counter narrative about, you know, us getting less and less healthy and people not listening or living more healthily, right? I have a piece of information for everyone to remind us. Actually, Singaporeans are, by some measures, the healthiest people in the world, right? Not just measured in terms of what everyone is familiar with, which is life expectancy, but health-adjusted life expectancy, which is the number of years you can live in good health, in a sort of a high-level sort of a summary of that.
In other words, to continue enjoying yourself.
Yeah, continue enjoying yourself before you have chronic conditions and disabilities coming in, which is, you know, another facet of the study that Cho Chuan talked about, the global burden of disease study. And Singaporeans have 73.9 years of health-adjusted life years, and that's the highest in the world. And not just that, and that's over 30 years, you know, an increase of about 7+ years. One of the biggest increases that we observe in the whole world.
Sorry, you're saying our healthy years. We now live on average 74 years of healthy years.
Yes.
And this has been going up, and
It's
hopefully will continue to go up.
Let's hope. And it's our job to, you know, all of us collectively, to make sure that we live not just longer, but longer healthier. Right? And these are real increases. And you may say, well, every country is doing so. Yes, but we have done so to a much greater extent. We have improved to a much greater extent than most other countries. And if you observe, for example, in Anglo-Saxon countries, especially in the UK and US, over the last few years, some of these numbers have actually come down.
Oh.
Right. So I think it is not something to be trifled with. I think it's a major achievement. And if you look at our diet, the amount of physical activity that we have, how much people smoke, you can see improvements over the many years. So I would like to say that, this is not an immovable constant of society. Habits can over time shift. I always like to cite this example when people say, it's a lost cause. I think all of us are old enough to remember when you entered an aeroplane, right, you sort of expected that the back few rows people could smoke.
Oh yeah, in the past they were allowed to smoke, right? Yes.
And, it was a part of life, right? Then almost everyone smoked. And guess what? If one guy tried to light up in a plane toilet now, you guess what happens? So I think big changes globally and also in our country has and can continue to happen. And I like to just say that, yes, lifestyle does drive a big part of all these major disease conditions, but lifestyle habits can absolutely change over the long term.
Right, thanks Z. As an insurer, Dennis, it's important to you that people stay healthy, so the longer they live healthy, the lower their call on insurance. I understand Prudential has recently introduced a new app called the Pulse app, and that's supposed to encourage people to stay healthy. Could you tell us? Can you tell us a little bit about that?
Sure. We believe in really leveraging on technology and digital to really partner with the customers, the policyholder, and the public to really improve on their overall wellness and health. So Pulse by Prudential was actually launched earlier this year. In fact, we launched it right smack in the middle of circuit breaker during the April period. And between then till now, we have seen about more than 120,000 Singaporeans downloading the app. So essentially, the app is actually a health and wellness app. And it does three main things. The first one is actually a digital health assessment that you can do very easily on the app.
What does it check?
So you can just answer a series of questions and you have an idea of your own health situation.
Okay.
So secondly, if you have some symptoms, for example, and you want to kind of confirm or you want to find out more about that, there's a symptom checker. There's that function in there. That's the second thing. And thirdly, finally, importantly, if you need timely medical consult, so there's this whole module in there, and it's very easy to use for telemedicine. I think that was very important, especially during the circuit breaker period, whereby the face-to-face was a big concern for members of the community. So those were the three main functions. And ever since then, we have started adding more fun stuff in there in terms of BMI recorder, wrinkle mirror index and stuff like that.
Wrinkle mirror index, okay.
Just to get people, to engage with the app. And we're going to have a lot more capabilities in there as well. So this is our way of partnering with our policyholders as well as members of the public, because anybody can download that, and that it is fee-free. You don't have to pay a fee. And we want to really encourage everyone to really live well and do all these different things and track your own health activities.
Joshua, did you want to see?
Yes, I think what we have learned is that just education is not enough.
Right.
It's necessary, it's not sufficient. And you need a combination of different things to really help people not just make behavioral change, but to sustain it. So I think providing information, feedback, nudges, gamification, digital engagement, I think those are very important tools. It's also important for us to see if you can improve the environment and make it easier for people to exercise healthier choices.
How would you do that?
It's making it easier for you to be able to access healthier food options. So if I were in a hawker center or a food court, and if there were many choices, salads, healthier choices, it makes it much easier for me to do the right thing in terms of healthy behaviors.
See, what you've been doing actually helps, yes.
If you have many walking places, so I think the park connector system is fantastic because of the COVID situation. I've been walking a lot and discovering all the park connectors. It actually makes it much easier. Pleasant, shaded, interesting, people are walking more.
Right.
So we need a combination of things that not just help people to make the choices, to make changes, but to make it easier
Easier for
also
them.
to live healthier lifestyles.
Yeah, actually, Z, you also have, I think HPB has got the SEPS challenge for several years. You've got a new high SG. How good is the uptake for those?
Well, uptake has been tremendous, and I think we do these programs from the same place as what Dennis and his organization is coming from, which is understanding that technology unlocks a whole range of potentialities for us to reach out to people and put health back into the hands of the individuals, right? I think we need to move away from this notion that somehow health is something that you go to a doctor and he gives it to you. No, I think the message from all three of us is that it's something that you can control through your lifestyle habits and that you need to own. And technology allows us to do that by being much more engaging, by giving us access to information and giving us reminders to do the right things at the right time. It also allows us to scale. You talk about adoption, right? So National STEPS Challenge, we have to date signed up 1.7 million Singaporeans into our programs. We have got another 800,000 people, well, there's some overlap, but yeah, who are in our Eat, Drink, Shop Healthy program, trying to get a bit of a discount and incentives when they buy healthier foods. So you can imagine in the past, without the help of technology, this kind of scale and engagement level that we can have using with these tools would have not been possible. I think traditional health promotion about writing posters, trying to get your nurses to nag at you and your doctor to remind you every now and then to please be a good boy or girl. I think it's a lot more engaging and more fulfilling experience now.
You just mentioned the word incentive, right? I believe Pulse also plans to do that in future. So what HPB and Prudential are doing, you're actually bribing people to stay healthy? I mean, does that make sense? Is it logical?
Well, what's wrong with a little sort of a thrill of getting? Well, we did a quick sort of internal stock take about the kind of incentives we give. So to earn 35 bucks off our STEPS Challenge program, you have to walk 960 kilometers, right? And that's all the way from Singapore to Thailand. So, I don't think people do it for money. But I think it's the thrill of the thrill of getting that voucher as a recognition. And we have a fair chunk of people who get the vouchers and they don't even claim it.
Right.
Well, I think it's you can think about it really as encouragement, support, assist people, right, in making the behavioral change. But I do want to add a kind of a cautionary note also, that technology is very important, digital engagement is very important. But we know that in almost every country, that there are a small fraction of the population that are harder to reach. They tend to be the lower income, people who are doing two jobs, and they tend to have more disease burden and requirements for healthcare. And we also have, at the same time, to take active steps to engage the harder to reach population and to also help them to embrace healthier lifestyles and more preventative actions.
But how do you reach these people? You can't use, as you say, they're harder to reach, they're the lower income, they're probably not very tech savvy, they probably don't take part in HPB's promotions or Prudential's promotions. So how do you reach them?
You have to use different strategies, either through trusted parties, partners in the community that have established relationships so that you're able to engage these communities in the workplaces, the way you select where you do screening, health promotion. I think you need very different strategies. They are complementary, the digital as well as
this is the people factor, the face-to-face one.
The people engagement.
You can't run away from the hard graft. Just to give an example of what Chua Chuan meant when you say, working with trusted individuals, right? So hawkers, right? I think we really have to take care of them, and they have no time to go and even see a doctor, and much less sort of take care of themselves, go for screening. So we've got to go down and reach out to the management association, the hawkers association individually, and you know, in most hawker associations, there's the boss, right? The head hawker, win his trust, persuade him to mobilize his colleagues to come over, and we have to go down and be there at the hawker center to do the screening programs for them, to get them to sign up for exercise programs, check on them. I think you have to move away from the idea that people need to come to healthcare institutions to acquire their health, but you need to reach out to them where they are, because this the more vulnerable people they are, the more they need help, and for you to get health accessible to them in a way that they can relate to and they trust you.
From our perspective, it's really important to really empower. So empower them. So having it easy and nudging them to really use through all strategies. I think that is important because ultimately preventative healthcare has got a couple of components, right? One is really you taking care of your own health and being disciplined about it. But the other one is really true, like what Z was talking about in terms of screening and all that. So I think it's important that we get the public to start working on these two things. And once they are able to do the regular health screening as well, I think it's important that through that approach, the entire outcome will be good. Because once you detect it early, in terms of your overall cost, it will be lowered. In terms of your outcomes, I think it will be a lot sharper. And in terms of the mortality that was talked about earlier, that will also reduce over time.
But people start worrying about their health as they get older. When they're young, nobody thinks that they're ever going to have a problem. But by the time they're older and they start having, high blood pressure, high cholesterol levels, etc., is it too late for them then? Cho Chuan, you said earlier that it's never too late. And I believe your Health Transformation Office is also trying to do something about improving the health of people who already have some chronic problems. Could you share with us what's on the horizon?
Yes, we have a number of programs that we find are very exciting. I'll just mention one or two. The first is we want to complement the work that's been done by the Health Promotion Board by implementing precinct-based health promoting activities. In other words, we want to work within housing precincts and bring together an integrated set of health promoting activities for the precinct so that we can make it easier for people living in the precinct to come together and do things that improve their health. So this will be an important complement to what HPB is already doing that crosses many, many different sectors. And in particular, I think we need a more precinct-based approach in order to engage the segments of community that are harder to reach, that do not traditionally engage with health promoting activities. So that's one area that we have been working on, and I think it's an area that could be very complementary to what is already being done. The second area that we think is really important and which is very difficult is mental health. And in mental health, we have, together with a number of partners, including Health Promotion Board, developed a web-based mobile application. It's called mindline.sg that allows individuals anonymously to do self-assessments. If you have difficulties that are causing stress, for example, job-related, income-related, it can point you to the right sites. But it also, through a tie-up that we have with a company called Wiser, provides intelligent chatbot as well as 100 over different exercises that you can use in order to improve your mood, help sleep better, cope with issues.
But when somebody has a mental problem, they've got beyond the point where, they are happy to start doing your 100 over exercises, etc. They need somebody to help them move out of maybe depression or things like that.
There's a range of, there are some which are really more about coping, and some people don't want to come forward because of the stigma. So the idea is to have a broader reach, to provide the self-assessment tools and ability for you to self-help. So the intelligent chatbot doesn't make you do exercise number 1 and then number 2 and then number 100. it points you to there's a diagnostic, and then it points you to the right particular exercises that might be relevant to you. And yes, if you need help beyond that, then of course you would be able to access a counselor, etc.
Are they live human counselors, or
yes,
is it just
human counselors, etc. Now that's a feature that has to be built still, because we have launched this. But I think we are trying to find a way in which we can address the issue of stigma and the desire for people to keep their own privacy, as well as to have scalable solutions that people can do a fair amount of self-management, and quite often that may be sufficient for many people.
Right.
And then if not, then of course you will need to see a human counselor or a psychologist.
So what's the website again, so that our audience will
It's
know?
called Mindline.
MINDLINE.
.sg.
Right, mindline.sg. How important is mental health when it comes to physical health? Does it affect physical health?
It's very important. It's very important, but I think maybe Dennis might want to say something about that.
Absolutely.
Yeah.
I think mental health is so important, and especially given the COVID situation with people working from home. So we definitely see this as an increasing need. And I think we see a lot of companies and likewise, right, for insurers really paying a lot more attention in this space. So that's something that we will continuously put our resources going forward as well. But I think overall, in terms of whether physical health or mental health, for us to really look at it from a national perspective, it needs the whole ecosystem to really work hand in hand in order for the nation to get even healthier in that sense, right? So it's not just the task of the policymakers, but it's also the task of the businesses, the healthcare professionals. But I think importantly, it's individuals. It's individuals and their families as well, taking that ownership to kind of move this forward together.
Health is always personal.
Very.
Yeah.
Very
And I
much.
would sort of say it's important to also see mental health from the preventive dimension. I think there's a prevailing mindset that, we get into periods where we need help and therefore we start seeking help. Actually, the better way to think about it is we develop skill sets on how to manage our own mental wellness, so that in times of challenge or stress, I think we'll be better able to handle this. So that few of us eventually will need to turn to other people for help, or we have potentially stronger networks of people that can look out for ourselves, so that as and when we do need that support, they can pick up the right signals to offer their support.
Yep. Actually,
Before
now-
we slide deeper into stress
Depression or-
situations.
yes.
And there's a strong intersection. For example, exercise helps. Being socially connected helps a lot. And sleeping better helps a lot. And so there's a strong connection
there's
between
some foods as
physical
well, right?
health and I don't know whether chocolates help. But that's not. Yeah, it may not be evidence-based.
Right. But Dennis, as an insurer, do you think the government should do a little bit more in keeping people healthier, or do you think they're already doing a great job and nothing more needs to be done?
I think the Singapore government definitely has been doing a lot of great stuff, and like I mentioned earlier, I think the partnership is most critical, right? Partnership for the whole ecosystem to work together. So I think the government has been playing their role. Insurer is now trying to step up, right, and continue that focus as well. So let's say from Prudential's perspective,
Right.
as a traditional insurer in the past, we have just been focusing very much on claims, right, and
Yes.
providing the coverage, and we will continue to do that. But importantly now is to really partner with the public and for the policy holders to really stay healthy, because if they stay healthy, the nation will be healthier, right, and more productive. And for us as a business, in that sense, we will be healthier as well, because the claims will gradually come down. So I think it takes everyone.
And I would say that is the big shift we have to make in our health system, in that it's no longer a delivery of care, but that individuals, patients, have to be much more active in participation in their own health as well as their own management of own diseases.
Right. So all these incentives you give makes it fun as well as useful. So I guess go ahead, continue bribing everybody. Can I turn back to prevention? Aside from healthy lifestyle, Prevention can also come in terms of vaccination. In fact, the Health Ministry has started subsidizing adult immunization from this month, from November. And see, this comes under the Health Promotion Board, right? All the vaccines for children and adults. Can you tell me, are vaccines very important in keeping people, preventing serious illnesses in people?
Of course, the answer must be yes, right? And, and I think a lot of the foundations of good health in Singapore for the many, many decades was our very strong youth vaccination program, right? We childhood vaccination program, and we take it for granted that so many of these infectious diseases that blights our grandparents and parents' generation, and also, as you can see in the West, because of vaccines skepticism has reared its ugly head again. I think in Singapore we've been very, very fortunate that these are not issues, right? And a big part of health outcomes is because we've kept our children immunized and safe from simple things like measles, polio, tetanus, and so forth. For the adult population, for the youth especially, we've started HPV.
Yes.
And we need to remind people that it's entirely preventable because it comes from a virus, right? The cervical cancer. And because we want to protect especially our elderly, so we want the pneumococcal vaccinations and so forth. So it is a very important part of the strategy. And even for COVID, right, there's so much talk about getting people for flu vaccination, so we keep the baseline level of what we call ARI, acute respiratory infection, low, so that all those signals that come from from the COVID doesn't get confused by some of these other signals we pick from just seasonal flu.
You mentioned HPV, so that's for cervical cancer in women. Cervical cancer has been coming down because I think more people are going for pap smears and all that. But if you go for a pap smear and you find out you have cervical cancer, you treat it, you don't die from it, but you still have the disease and you treat it, whereas a vaccine can prevent most of it. And I think years ago, we started with the hepatitis B vaccine, and that's reduced a lot of liver problems, etc. So Dennis, as an insurer, I mean, vaccines must be the best news in the world for you, isn't it?
So as an insurer, definitely we welcome anything that will help keep the public healthy, will help keep them out of the hospital system in that sense. And also as an insurer, of course, we provide the coverage for our policyholders. But the truth is that the policyholders hope that they don't have to really call upon it. Right? So I think, therefore, for vaccines, that's something that we definitely welcome that.
So anything that's preventable is preventable?
Absolutely.
So any favorite vaccines?
I think everyone is looking at what is the current situation for COVID. Yeah.
The COVID vaccine, because so many people are getting sick with that, isn't it? And since we have got the MOH's chief scientist with us today, could I ask Cho Chuan a little bit about the COVID-19 vaccines that are coming up? Will the vaccine, how will the vaccine impact the pandemic today? And is it the silver bullet everybody is hoping it will be?
Well, so first, before I answer that, I would say I consider vaccines to be one of the triumphs of modern medical science, because it's allowed us to be able to protect so many people from infectious diseases and also from cancers. So for COVID-19, if vaccines are found by the regulatory agencies to be effective and safe, then it will be a complete game changer. It will be a game changer because it will allow us to blunt very substantially many of the negative impacts of the COVID-19 pandemic. Maybe I'll just explain what I mean.
Okay.
So from the healthcare worker point of view, it will allow us to protect healthcare workers around the world. And when I talk to some of my friends in health systems overseas, one of the problems they face is that the medical staff get infected, sometimes during work, but often in the community, and then they are unable to work. And so the healthcare workforce is reduced at a time when demand is rising. And then this has a lot of additional negative impact on the care for patients and on the outcomes. It will allow us to protect older people, more vulnerable people who have much more severe disease and are at higher risk of mortality. And it will give us a much better way to control these big outbreaks, the super spreading events, which are otherwise extremely difficult to manage. And I think all of us also look forward to it allowing us to eventually go back to a more normal way of living. But while it will be a game changer, it will not be a silver bullet. As all of us know, the supply will be limited. By the time enough vaccine doses are made available to vaccinate enough people around the world, it will probably take a year or two. During that period, we still have to maintain the precautions, the safe distancing measures, the wearing of masks, because there will still be a very substantial risk of transmission and of outbreaks. So it will not immediately lead to a cessation of safe management. Those will still remain essential for quite a long time.
Right, so we will probably have to continue wearing masks for a while. Shucks. But you know, a lot of readers have been asking me about the vaccines, the COVID-19 vaccines, and their main worry is the safety. Vaccines normally take about maybe 8-10 years to develop, to test, and then to hit the markets. But now we are seeing within 1 year, you know, several vaccines potentially coming into commercial use. So with this rush to develop the vaccine, is it safe for people to actually get it?
Well, I would say that safety is the foremost, most paramount consideration. And around the world, regulators from the CDC to the European authorities, the UK, and our own HSA will be looking very, very carefully at the safety and efficacy data of all these vaccines to make sure to satisfy themselves that the vaccines are safe enough to be used before they can be approved. So a lot of independent experts will be looking at the data in great detail in order to ascertain that. A lot of the speed in which vaccines have been developed have been because of vast improvements in technology. The ability now to use new platforms, research platforms.
Are you talking about the messenger RNA?
RNA platforms, adenoviral vector platforms, allow for vaccines to be designed, developed, and tested much faster than traditional methods. And also the way we now run this big-scale clinical trials allow us really to bring that out. Having said that, I think we do have to recognize that the more common side effects like pain in your arm, fever after vaccination will be picked up. Some of the rarer side effects will be picked up because the studies have been done at a very substantial scale.
Right.
But some of the very rare side effects and some of those side effects which may take some time before they are manifest will not be picked up right now. But that's where post-vaccination surveillance is really important, that we track the sort of side effects that arise following vaccination and try to pick up as early as possible any signs of very rare or serious kinds of problems, and that then we take action very quickly. And this is an area that regulators and medical systems around the world are looking at very carefully, and there will be very intensive surveillance if and when vaccinations begin.
Yeah, actually, one question was, it may be safe in young, healthy people. Will it be safe in the vulnerable? You know,
so when the regulatory agencies and when expert committees look at this, they will look actually at specific populations to ascertain whether the data available for specific populations, including people with who are immunosuppressed, people with chronic diseases, whether the data is adequate to say that the vaccine is safe and efficacious for those groups. And it could be that at the beginning that vaccines may be approved or recommended for some groups but not for others.
right.
Until more data from ongoing clinical trials is generated, and until the regulators and expert committees are satisfied that within those specific subgroups targeted, there is adequate evidence of safety and efficacy.
Right. Well, that sounds promising. But you know, you spoke about new technology for vaccines. Will we ever see a vaccine against diabetes or, well, cancer? We do have cervical cancer. Will there be vaccines for diseases that right now there is no cure, really?
Not for, in my knowledge, not for diabetes, but there are a lot of innovations that are taking place. I would say that maybe a more a goal that could be more realized more early could be a better prediction of people who are more susceptible.
How do you predict?
So, for example, in Singapore we have a precision medicine program that looks at individuals who have consented to participate, and we have the genome sequences of these individuals, and it's possible to look at the cumulative risk that the genes that individuals have, which might help us to identify people who are at higher risk of things like heart disease, especially premature heart disease, and to intervene earlier. So to give you a specific example, there is a condition called familial hypercholesterolemia. So people inherit...
Sorry, in simple words, what does that mean?
So it's a gene that results in your having much higher cholesterol levels
Right, okay.
at a much younger age, and your family members get affected as well. And if you have this, then you have an up to 20 times higher risk of heart disease.
20 times, not 20%.
20 times. 20 times.
Right.
And it tends to happen earlier. So it is now possible to identify individuals in the community through genetic testing. And then if we identify somebody, we can also test the family.
Right.
So these preventative strategies will be part of precision health, which is something that I know Z and HPB are working very hard on, that we make use of clinical data, behavioral data, digital data, as well as genetic data with people's consent to identify who are at higher risk so that we can intervene earlier. I think that might be a strategy that would be more readily applicable in a shorter time frame than a vaccine.
Well, Dennis, I hope insurers won't start looking at people's genomes and decide that, no, I really don't want this person because the genome's not very good.
Privacy is really, really important, right? So definitely we are very, very careful about such things. And clearly, I think with a lot of advances in medical, the digital world and all that, we have to continue to work towards what is important is from insurer perspective, the ethics of it. So I think that is very, very critical.
So people who go for that, for Chow Chuan's program or Z's program, don't have to worry that you'll turn around.
Totally not.
And actually, it might be good, you know, if you find out that you're at high risk, you probably would then do something about it, and then it's actually good for the insurer in the long run.
It boils down to the individuals taking charge and wanting to find out more. So preventative healthcare is all about them being in the driver's seat and going through the whole process of early detection, health screening and all that. So I think as insurer, we definitely support
I think
that.
it would be much better than having people having heart attacks when they're 30s or 40s.
Yeah, that's really, really too young. You don't expect it, right? Yeah. You know, this is really very interesting, but we've been receiving a lot of questions from the audience out there, you know, who have signed into this webinar. So I think we should take some of the questions, their burning questions, and ask the panel while we have you here. Someone called H.C. Tan asked, is it necessary to go for a full health check annually? And what screenings are relevant for different age groups? Who would like to take that?
Maybe
Yes, I think it's a good practice, especially for older people. Although I would recommend that a more narrow set of screening be done. Certainly for high blood pressure, which is very easy to do.
Right.
For diabetes, for weight, and then for the different cancers, there are specific recommendations. Generally, it's going to be for colorectal cancer, for cervical cancer. So a narrow and recommended set of types of screening would be very useful, and it would be appropriate, I think, for people to do those. I would also say that for older people, it's also important to do functional testing, for example, like hearing, as well as sight, because some of these things may come very slowly and impair the function of the individual without them really realizing it. And it can then create additional problems like social isolation. And
Sorry, you say that when the eyesight is bad or the hearing is bad, they become socially isolated.
yes, because they can't participate in normal social activities.
Right.
And in fact, if you look at the modifiable factors for dementia, one of the modifiable factors is hearing impairment in a younger age. And if you have hearing impairment, you're at a higher risk of, it contributes.
How is that? Where is the link? I mean, if I can't hear, how does it affect my mind?
It's the ability to engage socially, to engage cognitively with different activities. The sort of a loss of sensory inputs actually isolates individuals and increases their risk.
So actually, all three of you have been talking about social interaction. So that's very important then, from what you are saying.
Yes, indeed.
Yes.
Yes, indeed.
Yeah.
So one of the biggest predictor of morbidity and mortality for the elderly is the degree of social isolation. You see. Yeah, and so I think you're very careful about people and who don't have relatives, who don't have friends, and major intervention. We talk about precincts, healthy precincts, right? How do you get people down from their homes to interact with their neighbors and friends? Is going to have a huge impact on the well-being and health of the elderly.
So Dennis, you want to keep your policyholders happy and healthy, have more parties, get them to...
Any way to engage our customers all the time.
But actually that is one of the impacts of this epidemic that we worry about, which is of course the degree of social isolation has gone up quite tremendously.
Right now, the pandemic right now.
Yes,
Okay.
and I think we need to watch that very carefully.
Recently, I was participating in a super aging conference
Okay.
based out of Japan, and loneliness and social isolation was a major issue. It contributes to a decrease in quality of life, and it also contributes to things like dementia and poorer outcomes. So it is a very important thing, not just because it improves quality of life for individuals, but they can also spill over and affect their physical health.
Right. So they sort of go into their own shell and then they don't participate, and I guess it becomes mental and physical as well.
And you can imagine the spiral continues, right? Because both effects will reinforce each other. Yeah.
So all of you out there, remember, go meet people, talk to people, interact, have chats like we are having right now, with the four of us here. Yeah. Now, Wendy Lim is asking, what is the best way to maintain joint health as we age, especially in the knees? I also have a problem, so can somebody help me? How do you maintain joint health?
Okay, so it is not an area of my specialty,
Right.
but so some general things which I gather from my orthopedic colleagues. One is avoiding injury when you are younger. Quite a number of people have injuries from sports and other things, and then that predisposes them later on to joint problems.
Then it's too late, isn't it?
It's too late, so you just have to be careful. The second is overweight. Clearly, as people put on too much weight, they tend to exercise less, their muscles get weaker, they start to get joint degeneration, they exercise less, so they put on more weight, and they get more joint deterioration. So weight control is a very important part of joint health. And then keeping your muscles strong and active is very important, because the knee is one of those joints that is held and stabilized through the muscles. Like if you feel your kneecap is actually not connected to anything, it's free floating. It's the muscles that stabilizes your knee.
Right.
And so if you have joint pains, etc., and you're able to do knee strengthening exercises, it often help a lot.
What sort of knee strengthening exercises? Will walking count, or
sort of a resistance type of light resistance type exercises to keep your knee muscles strong.
Right. Anybody else with personal experiences on how to keep your muscles healthy? Do you need to be weightlifters or?
Well, I mean, we find in our community health, physical activity programs that, people like to do things like Zumba, etc., which are more aerobic. But as Cho Chuan says, it's load bearing. You need to stress your muscles a bit, to acquire that strength. So over time, we've tried to introduce within the curriculum a wider variety of exercises that contribute to muscular strength. And I think the other point also I would like to highlight to our audience is this issue of a protein deficiency in the diet. As people get older, the appetite decreases, and we find that many of the older people are actually very under consuming in terms of protein. Up to, we ourselves say by how much, probably two to 4 slices of tofu you need to supplement based on the existing sort of median diet.
That's a lot of tofu.
There's a lot of tofu or a lot of chicken that you got to eat. But I think there's something that we want to send a message. I think people seem to feel that some of these things are not so important as you get older. Quite the contrary. Yeah.
So actually,
for me, the knee problem has been a personal experience. Because literally, when I was younger, I really loved distance running, right? So the impact on the knee, I think, is really quite severe. So over time, I really started wearing it down and really having some problems. So in the past, it used to be half marathons and even running the full marathon. So I think how I kind of try to manage that in the recent years is really do shorter distances and perhaps even moving in the recent period, right, especially with COVID and all that, to brisk walking. I think we just got to find different ways of personally managing that, and it's a personal discipline. I really, really love running, right? I kind of got to give it up, but move and pivot towards brisk walking.
And then after what Cho Chuan tells us, I think the two of us will have to start doing this weight-bearing exercise. We have a question from Joyce Tay. She's asking, exposing young children to long hours of screen time for daily e-learning, would that harm their vision? I think she's worried because now, with COVID, there's some learning from home, etc. Is that going to be a problem to their health?
There's quite a lot of evidence that near work, screen, reading, actually worsens myopia.
Right.
And there are a few things you could do. One is to actually let your children go out into the open, in the greenery. Some of the work done in the NUS School of Public Health has shown that if you go out enough in the bright sunlight, green areas, it actually reduces your risk of myopia, especially in younger people. The second is to take frequent rests from reading. And if you visit the eye center, there's this thing called 20-20-20. Every 20 minutes, you look up for 20 seconds at something 20 meters away. It's just to remind you not to continually focus on reading. And then there are some treatments that are available that the ophthalmologist can recommend. If you worry about worsening myopia in young children, there are things that you can do that can reduce the rate of progression.
Right. So I hope if there are any teachers out there listening to this and you're doing e-learning, do remind the students or your pupils every 20 minutes, 20 seconds looking away from the screen at something 20 meters away.
Right. Far. So the idea is far rather than near.
Right. Yeah. So every 20 minutes you look and then back again, and that's fine.
I wouldn't use that exclusively. I think you also have to get out and into the open, bright sunlight, etc.
Right. Now, I think this question is directly for you, Z. Annalise is asking, a lot of hawker food is unhealthy and high in fat, sugar, and salt. What can be done to help hawkers sell healthier food? You've been doing that for some years, haven't you?
Yes, we have been doing that for some, and that's the highest mountain that we have to climb. And again, I would like to be an optimist. 2 points. Change can happen. We made it happen with maybe one major segment of the hawker industry, which is your tea. As you now know, and I think Singaporeans would like to attest that now siu dai or kosong is a thing, right? And those who don't believe it, of course, we can't visit Johor now, But if you just cross the causeway to Malaysia, and you ask for kurang manis, the kurang manis in Malaysia is much sweeter than our plain teh and right. So I think our taste has decreased. Our preference for sugar has decreased. And I think that's the same strategy that we want to propose to hawkers. Don't change fundamentally, right, the tasty dishes that they do, but can they go a bit lighter in terms of the oil that they use, lighter in terms of the amount of salt that they put in, lighter in terms of the sauces that they put in. We can help out. We can work with the sauce manufacturers as we have to replace some of the salt with iodine salts, and to come up with different ways to add body and flavor to the food without adding sodium to those ingredients. We have also been promoting things like whole grain in noodles, and that actually has made a lot more progress than I thought was possible 5 years ago.
Whole grain in noodles, like
Yes.
red rice bee hoon,
Yes,
which I take.
you should do.
Yes.
You see, so that at least you would have benefited. You see, I had expected next to no progress, but we've made quite a lot of progress. So 5 to 10% of staples now have some amount of whole grain, and that's a huge step forward.
So let's hope this will lead to healthier Singaporeans, lower call on healthcare insurance, and everybody living longer lives. Thank you very much.
Don't burn my house down if your hawker food is not doesn't taste like original. Just small steps.
Well, we're getting a little bit short of time, but before we wind up, I just want to get to each of you and ask you: is there anything else you would like to add? I wanted to ask Chua Chuan something. There is this thing about gestational diabetes and the next generation. Could you talk a little bit about that before you do your wrap-up piece?
So it relates to the point I was trying to make that we should start as early as we can in health promotion, and it's never too late to start health promotion. And when we think about how can we start as early as possible, the earliest you can start is when a mother is pregnant.
Okay.
And during that period, up to 1 in 5 mothers in Singapore contract gestational diabetes. They get diabetes due to their pregnancy. And this by itself can lead to problems during pregnancy, but it also affects the baby. So if you are able to prevent or to manage diabetes in pregnancy, firstly you help the mother,
Right.
make the pregnancy safer, and also reduce the mother's risk of developing diabetes later on. If you didn't do anything, the mother with diabetes in pregnancy has a higher risk of developing diabetes later on.
Significantly higher?
Significantly higher.
Right.
But you're also helping the baby because there is some research to suggest that if you have diabetes in pregnancy in the mother, you create a propensity in the baby to develop diabetes later on.
Oh, so you don't just harm yourself, you also harm your baby.
Hang on to your baby. So if we wanted to do health promotion right at the start, then that's a good place to start. In pregnancy, in early childhood. In early childhood, there is research being done in Singapore that is looking at eating habits of the young.
Right.
Because and this is still not published, but the data suggests that the eating habits of the young affect their propensity, the amounts they eat, and the propensity for obesity later on, right? So there are a number of things that are actually not hard to do, but which can be very helpful in pregnancy. One final thing I want to say is there's also some research arising from work done in Singapore that mental health in pregnancy can also affect the baby. So if you have depression during pregnancy, it can also affect the brain development of your baby.
How does a woman who is pregnant stop herself from feeling depressed if she's feeling depressed?
Oh no. Then you have to provide support to the individual, and it often starts before that. And the depression may be triggered by a variety of things that may be unconnected with the pregnancy. But the point is, that we need to assess what are the things that are contributing to depression in pregnancy, and what are the things that we can do to help alleviate the situation. But what we don't know is whether by doing that we'll be able to improve the outcomes in the baby, and that is where the research has to go next.
Right. But at the very least, we know that if they control gestational diabetes, it's good for both the mother and the baby.
Yes.
Right. Before we go to the other two, we have got a question from Christina Tan, who's asking how company and the governments can help support productive aging so older Singaporeans can continue working. Because I believe Z said we are now living longer, healthier lives. Does Prudential employ older people, for example?
Absolutely. So actually what we do is we have even scrapped away retirement age. So there's no retirement age in our company for Prudential Singapore. And it goes with the whole thinking, right? This whole notion of people wanting people to live longer and healthier, live to 100 and beyond. So we thought it's important that we walk the talk. So we have actually done away with retirement age as a company. And in fact, even many of our group policies that we avail to employers, right, where the employers buy those coverage for the employees, we have removed that retirement age in that sense. So the coverage will go all the way up to 100 years old. So I think that is something that's important, and I think again it's not just from a one company perspective. How can we get the whole ecosystem to partner stronger going forward to kind of bring across some of these things?
The government launched the action plan for active aging in 2015, and as part of that, there's quite a lot of initiatives in helping older individuals to stay in work. The re-employment age has been raised. There is a support scheme that allows companies to redesign the work so that they can make it easier for older people to remain in work. And there are many schemes to help with training, reskilling, etc. Because the point about working in older age is not just from an economic or income generation perspective. It also gives you purpose. It and allows you to continue to have social relationships beyond your family, and they're actually very integral to successful aging.
Right. And I believe the university also has allowed people to work for much older than the nation's prescribed age.
Yes.
There is no use-by date. Dennis, before your last words, could I also ask you something? I believe Prudential started something called claims-based pricing, and that it has actually influenced healthcare behavior. Could you tell us a little bit more about that, and then with your closing remarks as well?
Sure. Claims-based pricing is actually something that we feel very strongly about, and it's something that we have launched about 3 years back. So specifically for our medical portfolio, medical insurance. So the concept is actually very simple. If you don't claim, or if you claim less, you should be paying less
Is
for
this
your
for your
premiums.
IPs?
Yeah, so this is for our private hospital rider plans.
Or the riders?
Yeah, the
right.
riders. So for people who don't claim, similar to, I guess, to the motor industry, right? So for cars, if you don't get into an accident, there's no claims and all that, then your premiums will be cheaper. Same notion in that sense. So if you don't claim, or you claim very little, then the premiums that you pay in the renewal will be up to 20% cheaper. And we feel that this will be a very sustainable way for us to really make sure that the whole ecosystem, right, between the policy holders, the healthcare providers, the insurers, the whole thing will actually be sustainable over the long period of time.
So if I claim, right, next year I pay 20% more, and it's going to be permanently 20% more.
Actually, from our data,
Right.
more than 80% of our policy holders who choose this approach, actually they don't claim. They don't claim, or they claim very little, and therefore they actually enjoy the premium reduction. So we happily will pass on this premium savings back to the policy holders. So we feel that this is actually a very sustainable method in the long run.
Yep. Health insurance is the one insurance you never want to claim. Yes, yes. So anything else you'd like to say before we wind up this session?
Sure.
Yes.
So I guess maybe just 2 quick points. We are coming towards the end of the year. I know it's been a challenging year, and the turn of the year is going to be happening soon again. Many people out there are perhaps looking at doing personal resolution and all that. So I think the first thing I would like to encourage everyone to kind of think about is take charge, right? Take charge of your own health. focus on prevention over protection,
Yes.
right? Focus on prevention over protection. And there's a lot of things that we have discussed earlier today in terms of preventative healthcare. So, but it starts with the individuals taking charge of that. And importantly also with COVID and with the increase of awareness in terms of protection, this is also an opportune period for people to kind of look at their coverage for themselves and the whole family. And very quickly, I think the second point is that we also talked a little bit about that earlier. Digital, right? We keep talking about with COVID, pivot to digital, a lot of work from home, a lot of digital pivoting for office scenario. So why don't we then think of this digital pivoting for ourselves? And we talked about using digital in terms of healthcare, preventative healthcare, all the different apps that's available. I think it's very simple, and now there are lots of proliferation of that. But it comes down to individuals really taking that first step, to take that baby step to really, it's quite simple, right? Just download and start playing around with some of these things and empower themselves to make those decisions for themselves and their families.
Right, so empowerment is important. Z, any last words before we close this session?
I would like to once again close on the point of optimism, which is to say that we will continue to evolve our behaviors. We will continue to get better as a society, and just to remind ourselves, right? And it's good that we have this conversation today. Even if you look all over the world, the number of people who've been affected by COVID, the conditions that we talk about in terms of chronic conditions, far outweigh in terms of impact and mortality and human suffering, COVID-19. I think let's not forget how important it is to continue this long journey towards just getting to be a healthier society, a healthier lifestyle. And the good news is you just need to watch just a few things, but you just need to watch them carefully. And living more healthily is just mutually reinforcing sets of social norms, and we are, I think, as Singapore, on the path to building those norms.
Right, so it looks like you've got a very big job to do, because like Cho Chuan says, keeping healthy is also making sure that it's easier for people to find healthier food, to exercise, the treks and all that. Are you going to, by the way, build more gyms for people to...
Virtual gyms, maybe.
Yes, now with COVID, it's going to be very difficult to go for physical gyms. Anyway, thank you very much, all of you. We've come to the end of today's webinar on keeping Singapore healthy. I hope you found the session as interesting as I have. I'm Salma Khalid. Goodbye and stay healthy.